Dressing changes to your child's Broviac should be done as ordered by your doctor. Typically, once a week is the minimum for chlorhexidine dressings, and twice a week for alcohol betadine or hydrogen peroxide betadine dressing changes. The dressing should also be changed if it becomes loose or the tape is not well sealed around the catheter. Change the dressing immediately if the dressing becomes wet or dirty because the site may become infected. To begin, assemble all of your supplies. Wash your hands with antibacterial soap or hand sanitizer. This is one of the most important things you can do to prevent an infection. Open your kit on a clean work surface in an area where you won't be disturbed by small children, pets, or other distractions. Your kit contains a mask, sterile gloves, a sterile drape, chlorhexidine swab, and a tegaderm dressing. Your kit may be slightly different. Discuss these differences with your nurse. You may also need additional tape or tegaderm, adhesive remover, extra gloves, and a second person to help hold or distract your child. Now carefully remove the mask and the package containing the sterile gloves. Remove and open the sterile drape. Only touch the corners. Gently place the contents of the kit and any other sterile items on the sterile drape at this time. Put on the mask. You can now remove the dressing. Hold the tube in place while slowly pulling the tape from the skin. Look at the site for signs of infection. These include swelling, redness, drainage, odor, and pain when you gently push on the area where the tube comes out of the chest. If any of these signs are present, complete the dressing change and call the doctor. Now, clean your hands with a hand sanitizer like Purell. Put on your sterile gloves. Putting on the gloves is probably the hardest part to learn, so make sure you practice until you are comfortable with how to put the gloves on and keep them sterile. Open the package, being careful not to touch the gloves. Pick up the glove with one hand at the bottom. This is the inside of the glove that will touch your skin. Insert your other hand, palm up. Do not touch the outside of the glove, which needs to remain sterile. If you are having trouble fitting your fingers into the glove, don't worry, you can fix this later. Now, using your gloved hand, insert your fingers into the cuff of the other glove with fingers facing down. Do not touch the inside of this glove. Insert your bare hand into this glove, palm up. Once the glove is on, you can touch glove to glove and you can adjust them so that they fit properly. Now that you have on your sterile gloves, you can touch anything on your sterile field or in the kit. To prepare the chlorhexidine, squeeze the sides of the handle of the swab together to allow the solution to saturate the sponge applicator. Next, use your non-dominant hand to hold onto the catheter and clean with your dominant hand. I'm right-handed, so I will hold the Broviac with my left hand and clean with my right hand. Scrub the area around the Broviac, the surrounding area that will be covered with the dressing, and the part of the Broviac that will be looped under the dressing with a back and forth, up and down motion for 30 seconds. Once you have finished cleaning, allow the clean skin to dry completely before putting on the dressing. Do not fan the site or blow on it to make it dry faster. The chlorhexidine kills germs that cause infection as it dries on the skin. Your dressing will also stick better on dry skin. Once the skin appears dry, loop the catheter upward. Make the loop in such a way as to not cause any kinks in the catheter. This is a safety measure to minimize accidental pulling on the catheter. Cover the exit site and loop catheter with the dressing. At this point, you can remove your gloves to finish taping the catheter. Apply an anchor piece of tape to secure the catheter to the chest. You have successfully changed your child's dressing.